Hello, welcome to session 2. In session 2, we are going to look at infections of the newborn. In this session, we'll look at infections of the newborn, Ophthalmia Neonatorium, Pemphigus neonatorium, oral candidiasis, cord sepsis, and neonatal tetanus. So that's the reading list. Infection of the newborn. That's our first topic. Mode of acquiring infection. How do the newborn acquire infections? So we are going to look at modes of acquiring infection. The newborn can acquire infection through transplacental, birth canal, hands of carriers when they are infected, contaminated objects, and droplets. And how do we manage infections of the newborn? The midwives have a role to play. And what are the roles? They have a role in preventing, diagnosing, treating the mother, the baby, as well as herself. So prevention in the mother. Before pregnancy, the midwife needs to counsel her on good nutrition, screening for infection, etc. Then during pregnancy, prevention and treatment of infections in the mother. So if the mother has candidiasis, she needs to be treated. Then after pregnancy, general information on infection prevention measures should be adhered to. In the newborn, how do you prevent infection? Safe environment. The environment should be safe. The mother should practice breastfeeding. They should maintain skin integrity and discourage visitors with infection. I quite remember a friend delivered and some people visited her. After they left, the child had chickenpox. So she called them, and one of them said that she's also having chickenpox, meaning that one of them brought it to the child. So when we have newborns, we should discourage visitors with infection, especially with upper respiratory tract infections, from visiting them. Prevention in the newborn, early diagnosis and treatment of the infection. You have to use individual equipment for each baby. You isolate infected babies and ensure infection prevention measures. For the midwives, we have to make sure we apply the universal precautions, which I'm sure you know, that is wearing of gloves, masks, goggles, and so on. Cover all skin lesions. Then changing gloves in between patients, disinfecting all blood splashes and spillage, and appropriate vaccination, especially against hepatitis B. Diagnosis of infection. Risk factors include, when you are diagnosed, you should bear in mind that risk factors include maternal history of prolonged rupture of membranes. It can predispose the child to infection. When the mother has high temperature during birth, the child is at risk of having infection. When the amniotic fluid is offensive, you should know that the child is at risk. And physical assessment that we usually do includes the following: temperature instability, the child becomes lethargic or has poor feeding, there is dehydration, starvation, hypoxia, bradycardia or tachycardia, reduced urine output or vomiting, and central nervous system signs. I'll take it again. Physical assessment. Those include observation on the following: temperature instability. Sometimes the temperature can go up, it can also go very low. The child becomes lethargic or is not able to feed well. There is dehydration, starvation, hypoxia, bradycardia or tachycardia, or even apnea. There is also reduced urine output or vomiting, and there are also central nervous system signs. Investigations and examination. So you can take amniotic fluid for CS. Then you can also do a full blood count or complete blood count. You can do CT scan, ultrasounds. You can also do a comprehensive neurodevelopmental examination. Then you take the cerebrospinal fluid for examination. You can also take specimen of urine and meconium for specific organisms. Swab can also be taken from the throat, the nose, or other areas for a specific organism. So management, what you do is that you provide warmth by covering the patient. You hydrate the patient. Yeah, so you give IV fluids, you give a lot of breast milk, then systemic antibiotic therapy. Then you have to monitor for neurobehavioral status. Then you encourage parents to be with their babies, and also encourage breastfeeding. So that is that for infections. We'll move on to Ophthalmia Neonatorium. What is Ophthalmia Neonatorium? It is defined as a purulent discharge from the eyes of the infant within the first 21 days of life. So within the first 21 days of life, if you see any purulent discharge, you should from the eyes, you should report to the hospital as soon as possible. So you inform the mothers when they are going home that within the first 3 weeks, if they see any discharge which is purulent, they should report immediately. Causative organisms include gonococcus, staphylococcus, strepes, and other bacteria. So this is how it looks like. And the clinical manifestation include the redness of the eye, then edema of the eyelids, and copious purulent discharge. As you can see from the image, is very copious, and is also purulent. The eyes are usually tightly closed, and serious condition may result in blindness if not managed. So this condition should be taken for granted. Mothers should seek help immediately. So how do you diagnose? You take a swab from the eyes for culture before treatment. Then for treatment, you isolate the baby. It's highly infectious, so you need to isolate the baby. You can also instill antibiotic eye drops. Example is crystal penicillin or Cipro eye drops, and maybe in the night, during the day and the night, you use the ointment to prevent the eyelids from adhering together. Neomycin and clinical eye ointment are also used. Then you can give systemic antibiotic. The eyes can be gently wiped with a dry cotton wool swabs. You need to also irrigate the eye with normal saline. Then the baby should be put on the affected side so that the parts from the affected eye will drain into the bed linen. We do that so that we don't infect. If one eye is affected, we don't infect the other eye. Then you wash hands whenever any care is given. Then you use disposable articles as much as possible. This condition can be prevented. And how do you prevent? The midwife should examine patients for every time the patient visits her for vaginal discharge. Ensure adequate treatment for patients with vaginal discharge during pregnancy. Baby's eyes should be cleaned with sterile cotton wool as soon as the head is born. Then instruct the mothers not to use their tamper with baby's eyes or wipe them with their own handkerchiefs. Instruct mothers not to tamper with baby's eyes or wipe them with their own handkerchief. Sometimes they use their handkerchief, sometimes they use their clothing to clean baby's eyes. We should tell mothers not to do that. Then installation of eye drops for all babies at birth no longer holds. We used to do that, but now we are saying that we shouldn't do that. We shouldn't install eye drops into the eyes of the babies when they are born. Then parents must be instructed to report immediately they notice any eye discharge. So that for Ophthalmia Neonatorium. We'll move on to our third topic, which is on Pemphigus neonatorium. What is it? It is defined as a bolus eruption of the skin and is also a notifiable condition. Causative organisms include Staphylococcus. It can be also syphilitic in origin. So when it's syphilitic in origin, you see the palms and the soles of the patient also being affected. So this is a patient with Pemphigus neonatorium. How do you manage? A swab is taken from the affected spot for culture before treatment. Then appropriate antibiotic is given both locally and systematically. So you can put smear some on the skin, and you can also give per oral. In severe cases, the baby is nursed naked, and bed cradle may be used to lift the bed clothes. Hibitin bath may be given, and daily examine the babies to detect occurrences. So that is that for Pemphigus. We'll quickly move on to oral candidiasis. Oral candidiasis is caused by a gram-positive yeast fungus. It is characterized by white patches in the baby's gum, palate, and tongue. It is characterized by white patches in the baby's gum, the palate, and the tongue. How is it spread? Mode of spread: through during birth, through the hands of caregivers, and feeding equipment. Bottle feeding during the first 2 weeks of life can also predispose the child to this condition. Then from breastfeeding women with infected nipple can also lead to this condition. Then early exposure to antibiotics can lead to oral candidiasis. So this is an image of the baby with oral candidiasis. As you can see, it has white patches on the mouth. So the signs, in attempt to remove the white patches all over the tongue or cheeks, raw areas are revealed. In mild cases, the general health of the baby is good, but in severe cases, the baby may refuse feeds, and the baby will become irritable and may pass watery stools. So we usually give antifungal drops to the baby every 6 hours, and pregnant women, we can prevent this condition by also treating vaginal candida infection in pregnant women. It can daily inspection of the mouth of the baby also helps in prevention. Then isolation of infected babies. Severe cases must be referred, and when the nipple is infected, we need to apply antifungal cream on it. Now let's look at cord sepsis. Cord sepsis is infection of the umbilical cord. The cause is the use of improper cord dressing technique. Some people use cow dung, some people use all sorts of herbs in dressing, and it can lead to infection of the umbilical cord. The sign is an area around the cord is red and inflamed. In severe cases, there is greenish discharge which is offensive. So we can also prevent cord sepsis by the midwife doing the cord dressing. The cord dressing should be done by the midwife, not by the mother. Dressing arrangements should be made when the mother and the baby are discharged after delivery. Ask mother to seek medical aid immediately if the area around the umbilical is red and inflamed. Then complications. Cord sepsis can lead to complications such as hepatitis, jaundice, and septicemia. They can also lead to abdominal discharge, and it can lead to hemorrhage. How do you treat cord sepsis? You clean daily with methylated spirit. Then you can also take a swab, and appropriate antibiotic can be given. Our last topic for today is on neonatal tetanus. Neonates also do have tetanus. What is the causative organism? The causative organism is Clostridium tetani. So let's look at the pathophysiology. If you understand the pathophysiology, then you'll be able to understand the presenting features of the patient. So what usually happens is that exotoxin is introduced to the skin. When the organism enters the body, it reaches the ozone of the nerves, and it liberates some toxins which affect the nervous system and causes muscle spasm, rigidity, and painful paroxysmal seizures. What are the causes? The causes are infection, when there is infection during delivery, or when the delivery is conducted in unhygienic environment. Another cause is poor method and managing of the cord, using cow dungs and herbs. Then cutting the cord with unsterilized material. Cutting the cord with unsterilized materials. Signs and symptoms: there is locked jaw, there's a trismus, and there is difficulty in swallowing. There is laryngospasm, there is respiratory distress, there is intramuscular hemorrhage which can lead to death. There is general muscle spasm as well as spasm of the jaw which prevent the baby from sucking, and there is the baby cries a lot, is irritable. There is Opisthotonus. That is the image that you see. That's the position that the baby assumes. Opisthotonus. So that is Opisthotonus. The face is wrinkled and the child wears an anxious look. You can manage by giving IM injections of 15,000 units of anti-tetanus serum. You can sedate the baby with Valium and Lagatel. You can also give paraldehyde and crystal penicillin. You can, and because the baby is not able to feed well, you have to pass NG tube and feed the baby through the tube. Management must be constantly cleared of secretion. Give oxygen as often as required. Disturb the baby as little as possible. And all procedures must be carried out when the baby is heavily sedated. We don't want to disturb the baby. Prevention: this condition can be prevented. So when mothers are pregnant, they should be given the tetanus toxoid. Delivery should be conducted in a clean environment. Then the cord should be cut with sterile blade. Babies born in unhygienic conditions should be given prophylactic anti-tetanus serum 750 units after initial test dose. Then all newborns must be immunized against tetanus. Then established cases of tetanus must be reported and admitted immediately. Today we have been looking at infections of the newborn. We have looked at neonatal tetanus. We have looked at Ophthalmia Neonatorium. We have looked at Pemphigus Neonatorium, and so on. Thank you very much.